How do blood and urine FSH tests differ for menopause? Imagine trying to catch a snapshot of your hormone levels to understand where you are in your menopause journey. That's what FSH tests help us do. FSH, or follicle-stimulating hormone, rises when your ovaries slow down. But how we measure this hormone can vary quite a bit. Blood FSH tests measure the hormone directly from your bloodstream. They give a precise picture of how much FSH is circulating in your body at that moment. This makes blood tests very reliable for doctors to assess your menopausal status. They usually take the sample on specific days of your menstrual cycle, often day 2 or 3, because FSH levels naturally fluctuate during the cycle. Urine FSH tests, on the other hand, detect FSH that your body has excreted in your urine. These tests often come in the form of simple strips you can use at home. They work by identifying the amount of FSH in your urine sample. They are less invasive and more convenient but can be a bit more variable. FSH levels in urine can change throughout the day or depending on how hydrated you are. Because of this, a single urine test might not give a clear answer. Repeating the test over several days can help improve accuracy. Timing also differs between the two. Blood tests are usually done in a clinical setting on specific days to get consistent results. Urine tests can be done anytime at home without worrying about the cycle day, but factors like hydration can influence the results. In terms of use, blood FSH tests are considered the gold standard. They are used by healthcare providers to confirm menopause, especially when symptoms are unclear or if early menopause is suspected. Urine tests serve as a handy screening tool for women who want to check their hormonal changes at home. If a urine test suggests menopause, a blood test is often recommended to confirm the findings. Both tests reflected the increase in FSH that happens as your ovaries produce less estrogen. This rise is your body's way of trying to stimulate the ovaries to produce more hormones. Monitoring FSH levels along with other hormones like estradiol can give a fuller picture of what's happening during menopause. So, to sum it up, blood tests give a more accurate and dependable measure of your menopausal status, while urine tests are easier and more convenient but less precise. Knowing these differences can help you and your healthcare provider decide which test is best for you during this transition.